One moment. Okay, we are live.
Okay, great.
Welcome everyone to the Public Health and Real Life channel. Today we begin an interesting series of public health interviews with experts from the private sector who will discuss about improving health systems globally. Today, we have an interesting individual who brings quite exciting and unique background. Anna Lobanova is a Russian-born Belgian citizen, educated in Spain and the US, living in Dubai and working with Asia and Africa. Her healthcare business development and marketing experience is stemming from 14 years of international uh, working with an international global company with more than 15,000 employees worldwide and market capitalization of nearly $4 billion. She's been leading multicultural remote teams for many years now. Her last role was marketing director for developing markets. In this role, she was covering developing markets such as India, China, Eastern Europe, Middle East, and countries in Africa and Southeast Asia. Her multicultural experience will provide us with unique insight into how medical markets function in international developing markets. So, uh, with no further ado, Anna Lobanova, welcome to the show.
Thank you, Ashwin, for this
I'm
kind
also
introduction. My pleasure to be here with you.
likewise. So, I'm also joined by my colleague, Dr. Maimuna. We want to start the conversation on how do we bridge public health improvement with business growth. This is a unique background that you bring to the platform. There's a lot of people who either go in private sector or public sector, but really making the connection between both is something that you bring unique to this conversation. So with no further ado, we'll just start with the question on bridging public health improvement with business growth.
Thank you. Yeah, sure. So indeed, I'm coming from experience of a big multinational, and we have worked in many, many different countries. So as Ashwin has mentioned in my introduction, in fact, we were covering such markets as China, India, Russia, all the biggest developing markets. And this is where the struggle is real. We do have a significant difference in the level of education, and this word you will hear from me really a lot. And in terms of possibilities that public sector has versus private. So one funny discovery is that, in fact, in my experience, in many countries, the structure is very different. In some countries, public network is much stronger. Example would be China, where primarily all the biggest hospitals, all the biggest healthcare centers are government owned. And then we have some countries where private is leading the way. Example of that would be my country of origin, Russia. And this is one interesting finding. So when we are looking at private versus public, a lot of the time it's really depending on the geography itself. Secondly, what I found is that for any kind of company in the medical field, one of the most important growth vehicles is education. So as I mentioned, we will speak about it today a lot. Yeah. My strong belief is that bringing relevant information to the healthcare professionals is what makes the difference in both sectors. And that has been my journey. So example would be, we have had a headwind where in developing markets, people were struggling to adopt more innovative, higher quality products. And the reason was very simple. The reason that we find a lot in the developing markets is, of course, the pricing. So the cost of the product people viewed as excessive. So we found out that at the same time in US, they are in fact on the government level, at the level of FDA, banning the use of older generation of products. And this was a golden opportunity to take this learning from US and bring it to the developing markets and explain to them not only that, okay, US is banning, but really the reasons why clinically this is relevant and important. And that has been a really big growth platform for us as educators. An example would be, we talked to the healthcare authorities in Philippines, for example, explaining to them that, look, this is what's happening in the developed world. These are the implications for the healthcare professionals. These are implications for their patients. And we believe that this is the right way forward to endorse newer generation of products. Guess what? In half a year, they had in fact banned the old generation of products. And this is a country that is not extremely rich. It is price sensitive, but they saw the value clinically of this type of solution being relevant for them, even though the prices were a bit higher. And I think that's really the key for any market is education, education, education. Why am I there? And what do I bring to the table in terms of innovation?
In terms of your background in terms of corporate social responsibility, what do you think is the role of organizations in of course with COVID-19 vaccine, we see that private sector has had a huge role, of course, in improving the health of populations. However, in this conversation we are talking about health systems, so increasing access to affordable medicines and health technologies is one of the components in the World Health Organization's definition of health systems. So, in terms of bridging the gap, you would have had difficult conversations both within your organization as well as with the countries where you had to launch these medical products. So, for an up and coming individual who might be working in the business development arena, what would be your advice?
I mean, in terms of corporate social responsibility, let's be honest, in some countries, this has an advanced impact, and in some countries, less so. For comparison, if we are talking, let's say, Sweden, they have the most sophisticated requirements, and this is requirements for tenders in both private and public sector, where they ask people to provide evidence of doing CSR effort as a company, and that plays a significant role when you will win or lose the tender. And that makes sense, honestly, because this is where the whole world is going. However, if we're talking more developing markets, it becomes a harder conversation. So there, you need to convince people first with education, but I think it is linked to CSR anyhow, because example, if you will have less complications for your patient by using more advanced technology, that also brings some CSR value to that. But it is an interesting conversation because today, more and more, we see that it matters. One of the interesting stories here would be Malaysia, where they had to update a lot of the human resources practices in order to be compliant with CSR. And then we have also countries that are in the developing world. Example would be India, where they are introducing environmentally friendly practices.
Right.
And that's also something that is an emerging trend. So I definitely would not ignore it. I think that it's not only ethically right, it is also a smart business move as well, and it's
Right.
quite important.
Right.
Yeah, thank you for that insight, Anna. That is really helpful to know. Of course, you know, the world is dealing with the global pandemic, and at some point during the pandemic, all countries, whether it's developed or developing, faced shortages of with
Yeah.
PPE and other supplies. So, from a business perspective, can you elaborate on why that happened and what
Yeah.
the world should do going forward?
I mean, it's as simple as having a gigantic input of income of demand, and it was just shock for the system, really. So all of the big players in the market, they are focused around production capacity. They have a plan, and that plan simply went down the drain immediately when the whole pandemic situation happened. Nobody predicted it at all. And from the business point of view, it was a shock, truly. I think the other difficulty is that we're here talking about quite advanced technologies. So it would be very tricky to add capacity. So yes, there were, of course, immediately some outsourcing solutions, and yet it was still not enough because just the pure production capacity in the market available, it was too little. And to add it, you would have to build new factories, truly. This is what I have seen. So I'm coming from the background in surgical disposables and, in fact, in masks. And this is where you saw exactly this. You suddenly are faced with demand which exceeds the available supply by times, yeah, 3 or 4 or 5. And in this situation, not at all easy to remedy because of simple constraint of capacity to, and yes, I think this whole crisis, it will change the dynamic a bit. I think people will think longer term in terms of capacity and healthcare in general, because I think it's also no secret that the whole pandemic has highlighted how a lot of the countries were getting by with the healthcare service levels that are not sufficient, yeah, and the capacity at the medical centers even is not sufficient. So I think we will see some forward thinking with the pandemic. I'm quite sure that's going to be the case.
Yeah, you do raise a great point about capacity and the fact that it was a shock to the system.
Yeah.
Interestingly, Bill Gates and a few other global health leaders have said the world should actually be prepared for another pandemic, possibly soon. So, what do you think those steps should be that organizations should start investing in now to prepare
Yes.
for a possible pandemic?
I think that's key, really, because it's not only pandemic, it's pandemics. If we look into the past, there have been a few incidents where in certain areas of the world, it was not as global as what we're dealing with right now, but in certain countries in the world, there were sparks of Ebola, MRSA, there was a few of them. And they all had a dramatic kind of effect on the supply chain. Now, at that point, a lot of the companies ignored it. They saw this big peak, survived it, and that was deemed okay. I think this one is very different because really, literally, every single country felt it. So, yeah, I really believe that if the company is smart, they will have to invest in more capacity and invest in better supply planning as well, because it's not only about having physical product, it's also about the infrastructure to deliver that product to the market, and being a bit perhaps more forward thinking when it comes to regulatory implications. And this one, if you ask me, is definitely key in the developing markets, because CE mark or FDA approval, it's a, you know, people know how to do that. It's costly, it's difficult, but they know how to do, and many companies are doing it successfully. The developing markets, the system of getting that approval is sometimes as long as 18 months. So again, if we want to have the right product at the right time, we might want to invest into registering in bigger countries where we did not have registrations previously, because if something like this happens, we
Right.
need to be able to supply.
But in terms of the PPEs, PPE availability in the countries and building the capacity, what are some steps that countries need to take today to ensure that at least they have the partnerships in place to face or address a pandemic-like situation in the future?
Now, I think first of all, we need to see what is currently available, what type of products,
Right.
and what we will find is that in a lot of cases it's insufficient.
Right.
Then also what would be interesting to see if I were in those shoes is how is that PPE used?
Right.
Why that? I'll give you an unfortunately unpleasant example. So in theory, examination gloves, yeah, everybody now knows what an examination glove is, yeah?
Right.
So that was not the case. What do I mean? So a lot of the times people would ignore to put an exam glove on.
Right.
In some countries. They would ignore changing it. They would then reuse sometimes. And I have seen all of those in my markets. Now, the implication of that is you are not safe. So I would definitely look at making a more stringent regulation and seeing how that looks. Because actually what you may find is that to do it properly, you need to double or triple the supplies that you're getting. And reality, in many countries, that would be the case. If you look at the sizes of the markets as they are estimated, you can see that there are some serious gaps. Then once you understand what are the kind of requirements that you're really facing, then of course you would have to find the right partner, but that right partner at the same time needs to look at what are the opportunities. Is it upgrading current facilities? Is it adding lines? Or is it doing a greenfield development? And if I were in those shoes, my recommendation would be greenfield development, saying, look, I will prepare myself for the future and I will build a completely new line and completely new factory to make sure that I serve it right. If it's not used during non-pandemic times, maybe it will be used in the pandemic times. And I am a believer that we will see another pandemic. Maybe we will deal with it differently, hopefully, be more prepared. But yeah.
See, this is where, in terms of adapting to new technologies and products, what are some of the challenges that healthcare workers face in terms of whether it is knowledge about the new technologies or adapting it to the countries, whether it is a cost or whether it is regulatory constraints with getting the product into the country, and in context of a pandemic, that is, see, there are X challenges. If you can please elaborate on those challenges first, and then how can those challenges be better addressed for pandemic-like situations to adapt to new products?
So let's start from the beginning. Like, what are the challenges? Firstly, I've mentioned education, right? That's my favorite word. So education. Doctors and nurses and general staff in the hospital, what they are is they are professionals in their field, which means they are great at doing surgery, performing procedures, treating the patient. What they don't know is the technical and even material science part of what goes into those products. So making them aware of the clinical difference that the product can make is essential. Example, and this is, I think, very relatable for many, allergies to medication and to latex. Today, we all know in a good hospital, when you come as a patient for a surgery, what do they ask you? They ask you, do you have any allergies? Why? Well, because they don't want to kill you. But what they don't realize is that, firstly, the patient may not be aware, which is an entirely different situation, but the doctor may not even realize the link. Example, do you know how many latex articles, disposable articles, are there in the general hospital? Statistics says 17,000 different latex items. That's a shocker. So when you bring to them the knowledge of, okay, this is what allergy is like, and it's not just flu-like symptoms, where we're talking about really serious damage that it can do up to death, and you show them statistics, this is where they go, oh, okay, makes sense. Then the second part comes as to how do I improve the situation? And this is where the companies, they have to do this educational job and tell the healthcare professionals, because those, they are experts in their field, but they cannot know everything. So it's then becoming your job as a supplier to inform them properly. And I think everybody realizes in any market that this is the situation. So with that, coming to the second part of your question, which is the barriers. So yes, often you hear, oh, we don't have the money for that. Okay, very frequent conversation. Now what we discover is that it means they're not very convinced. And here you have two venues. One, have a really strong clinical evidence behind the product. And of course, promote that clinical evidence, meaning do educational seminars, talk to the authorities to explain to them also the impact and the difference. And then the second part is, of course, total cost of ownership, which is an important piece. So if we are talking about total cost of ownership, this is where you realize that by saving cents, you are losing dollars, right? Example would be, again, this latex type of products. So cheap, very easy. Problem is that if you have one anaphylactic shock, that can be up to $10,000 and more in payments to that patient. So have you saved money really? Maybe not really. So explaining this mathematics, important. And then, of course, there is the regulatory constraint. That one is a real pain. So in some markets, it takes up to 18 months to register products. And the countries themselves, they need to do better. And I think there are two parts to this story. So producer, we have to educate about the product and the clinical impact and comply with the regulations. On the government side, they need to see the value of making their processes and their whole regulatory framework more comprehensive and at the same time effective. This is not the case right now. And oftentimes it takes this disaster like what we had to start realizing that, hey, I need to move quicker on this. In my experience, some of the markets, 18 months, and even then, still more.
But why is that? Because in some markets, they say that, you know, the regulatory markets are very thin in some of the countries, that there's no proper regulation or there's no proper kind of oversight on things. And then you also have this kind of scenario where certain products being admitted into the country take a long time. So is it all part of that inefficiency?
Yeah, I think so. I mean, it's about the infrastructure that they have and how they see this. So some of the markets, they would accept, for instance, European or US registration as a endorsement of the product, and they would be fine to admit this product into the country. Some others, they want to go their own way, like my country of origin, Russia, China, they have their own process. Problem with having their own process becomes then that you have to have people to do that process. And that's where we have a bit of an issue, because firstly, are there people available, especially in the pandemic, by the way? So we have seen delays in regulatory approvals because of the pandemic. because the governments were closed, they were working from home, all those things we have seen. Now, how do you deal with that? Hey, you hire and you educate your staff. Now, the education bit is yet another bit, because the fact that you have the person sitting there doesn't mean that they understand everything fully. And that's a pain. And again, in some countries, it's maybe harder than you'd expect. Example, in one of the countries I will not name, but it's a big country, we had a situation where from one day to another, they decided that the packaging of the product has to be clearly stated on the registration of the product. And that was not the case before. And you could not sell with the old certificate after 1 month. And it takes 12 months to register in that country. What do you think happens? Shortage of product, obviously, because nobody can bring it because they don't have the new certificate. And the new certificate takes 12 months to get. So yes, it is, countries need to put some thinking behind it, really. It's not easy.
Well, thank you for sharing that that particularly interesting example. And it's like you said, there are a lot of regulatory practices that I think lay people are just not aware of, that further enhance these shortages. You like earlier you mentioned education, educating healthcare workers, educating people within the supply chain
Yeah.
pathway. Do corporations invest in research that helps enhance that education?
Normally, yes. The market leaders definitely are, and so they should, because in order to educate, you need something to educate about. So if you believe that the product is truly bringing some value to the market and is it making a difference, you need to prove it. And to prove it, yes, you do need to do research. And clinical trials, white papers, educating, it all requires, a certain research. And I think it's key, really. Plus, again, if we're back to my favorite topic also of regulatory, you also need to understand, is the product meeting the requirements, really? And it might seem like a great product on paper, but in reality, it's not meeting the requirement. So that's another important subject for research, is to do all those tests and really come up with something that is making a difference for people.
So in your experience, do you think all parties and all stakeholders are equally invested in this research?
I would not say equally, some more, some less. Of course, you always have followers in the market, no label brands that do not really care that much about the brand reputation, and they just shall sell cheap, cheap, cheap. That's one approach. But I think reality is that in medical markets in particular, it is a scientific community. And if you think about it from any reasonable perspective, you realize that, hey, I need to do something that is actually helping people. That's what the business is. The business is keeping people healthy and discovering new ways to keep them healthy. So if you're a major player, you will invest in the research for sure. And of course, there will always be me too's, but yeah.
But in terms of talking to people in multiple nations, one key area that's important is multicultural marketing.
Yeah.
Can you elaborate a little bit about what is multicultural marketing and what is its importance, and how can young young leaders can improve their multicultural marketing skills?
I think one major point there is, do not make assumptions and judge based on those assumptions, because what you discover very quickly is that what works in that one country does not mean it will work in another. And I think it's about humility, really. All the markets, they have something to teach you. And if you're listening and you're willing to learn from them, you will discover what it is that they're trying to tell you. If you come from the perspective, I know everything, chances are you know nothing. And that has been my experience, really, is that you come to very educated people with something that is scientifically based, but you do still need to have a respectable conversation about it and hear the feedback as well. And to me, that's probably the core of multicultural marketing, is really understanding who you are talking to. There will be some similarities, there will be some differences depending on the market, and you have to accept that. Just be ready for it and learn from it, and you will thrive. Or if you just ignore it, then you will never go anywhere. One other point is relatable marketing, and that is the trend now. Again, I will give you an example. So one of the first campaigns that I have done, it was a campaign for all different markets in my portfolio, so developing markets. What I saw there was a similarity in terms of what products they use and what products they don't. And there was a similarity in terms of their perception that the newer generation of products is more costly. So we decided, hey, let's make a campaign for them that will explain this. You know, sounded like a good idea. And then we started briefing marketing agencies. And what I saw in 9 out of 10 cases was Mr. White Guy as the face of the campaign. Nothing wrong with Mr. White Guy, but it does not relate to Asia. So that is just common sense, right? In the end, what we did, we went with an agency that gave us this versatility in terms of imagery, in terms of language, something that was relatable for different markets, not for Mr. European Guy, but Asian woman, Indian surgeon, all those different populations that were simply ignored by the standard campaigns. And that, to me, again, is something you need to think about. It's not only just taking the material and translating and copy pasting. It's important to translate in some of the markets in particular, but it's really making it relatable to the market.
That's really an interesting perspective you bring about diversity, even in brand and marketing. And I think with just events that have happened across the globe, there's just this increased awareness on diversity, and then bringing underrepresented faces and voices more into the field. Like you rightly pointed out, what is the cost of not diversifying, even in your brand and marketing, or in like your product marketing?
So let's do some math. Yeah, we have China, 1.5 billion plus people. We have India, 1.2 billion plus people. Now, if you're not diversifying into those markets, what are you doing? You're ignoring 2/3 of the world, and that makes no mathematical sense whatsoever.
Yeah. I like that very simple analogies, like making a business case for diversifying. And I think a lot of people tend to see any of those things that deal with equality, equity, access as a cost to their business. And I think helping make that business case or business sense is really helpful. So now in that sense of like business, seeing healthcare as a business, one of the things that we usually advocate for is establishing or expanding public-private partnerships. So in your experience, how have you managed that in, developing public-private partnerships, and what have been the challenges also?
I mean, the challenge is still the same. You always hear like, oh, what is it going to cost me? If you bring the right argument clinically, you can talk to the relevant people. One of the ways we have been doing it is we were contacting different associations in different countries. It's a bit of tedious labor because you have to find those people and you have to talk to those people individually. But then once you have that rapport and you're able to explain to them the value, then you have all the educational campaign around it, and that starts to work. We have done that with Russia, we have done that with China, we have done that with India and many other countries. It's really about explaining to them why. which makes sense. I mean, if I'm a doctor and I have been using this product for 20 years and I think it's good, why do you come to me and tell me that I need to change? I don't want to change. Why would I? Like, this is a trusted, proven product. Why do I have to switch? So to me, in order to achieve that, to get him to change, what you need is you need to tell him why. And to tell him why with facts and with clinical studies. Then you have a completely different conversation. You say, okay, yes, it has worked for 20 years. No disrespect. However, the outcomes, clinically speaking, with this are going to be much, much better. And we can prove it. Here is the study. This conversation opens a lot of doors. And first, of course, as I said, associations, be that Royal College of Surgeons or be that China War Nurse Association, these are the people you have to talk to and convince them. And then it becomes a partnership, but they need to know what are you really bringing to the table.
Right. And you have a long experience in marketing, and how has the trends changed in the recent past, especially with the world becoming virtual? And can you also talk a little bit about your new initiative, 10x Marketing?
Thanks for that question. Now, I think one of the things we saw, honestly, to be completely transparent, we have seen it before the pandemic, is more and more information becomes digital. And less it becomes face-to-face events, it becomes more webinars and more online presence. And this was a shocker for a lot of B2B businesses, medical being one of them. So in the medical field, it was viewed normally like as a luxury. Yeah, you have to have a decent website because, people search for you on the web. So, okay, but that was it. Maybe some social media campaigns, but primarily it was still old press and events that were driving the education. Today, it has changed and it will stay changed, I think, forever now, really. So we saw that it's critical to reach the people where they are, and that's internet. Now, which specific channels and which specific messaging, it depends from business to business. Even in medical business, you will have major differences. One example I will bring is, so I'm coming from a very OR-driven surgical environment, and I have been working on a project for aesthetics company. And you can see that in one case, the messaging is entirely B2B because, it's a hospital. So you're talking to the chief surgeon, chief nurse, you're talking to purchasers, while on the aesthetics, it's still quite medical, huh? But you are talking more to consumer. And that also makes sense. So finding this right recipe, business by business, and finding the channel that works for you online, very important. And that's actually what I've done. So I started my company with this in mind in the very beginning of pandemic. So it was quite interesting to see this. But yeah, a lot of companies now, they pay much more attention to the presence online and how that is treated. A lot of the times you really need, like using the tools, not an issue. This you can learn easily. But it's the same as with traditional marketing. You need someone to be strategic about it. Think about, why do I want to talk to these people? Who exactly? What am I going to say and where? This is where a lot of learning is coming from now. And my company is doing exactly that. So I'm specializing in building that digital marketing strategy with all the implementation steps. And I think that this is where we're going in medical business, because it has been traditionally quite non-digital and it was very, very difficult. But I think we're seeing the change now.
Right. And you have an interesting background. You bring a bachelor's in economics, master's in painting and drawing. Then you did an MBA uh, in Spain. So, can you tell us a little bit about your career trajectory and also about your background in painting and drawing and how it has influenced your new business?
I mean, where I'm coming from is, yes, very mixed background. So I've done business for a really long time. So I've started in 2006 in the medical field, and I have since changed different roles within regulatory marketing and sales. And now I really am looking at my career as owning my own business and making a difference that way, helping people bring their product to the market. And to me, it's really a lot of fun because it requires some magic thinking process that's not so easy to find. And that's what I'm focusing on, bringing that knowledge that I have. Now, why art? So this is something that I grew up with. Um, in Russia, it was not a valid career choice. So I discovered that even after all these years, I still love to do it. And what I'm doing with my company as well as I'm bringing some visual literacy because it's important. Sometimes you look at the picture, you go like, I like it or I don't, but you don't know why. And coming from the art perspective or graphic design perspective, this is where you can actually help people say what they want to say visually. And to me, this is one of the key selling points is saying, look, it's not only about the material itself, but it's also about visualizing it. And a lot of people are visual. With social media, especially, it works very well because social media is very visual these days. Nobody reads the whole thing. Everybody looks for the highlights and a nice picture, right? And it's important to realize how the brain is processing this visual information. So to me, this is, yes, it's a passion, and I'm bringing it to my marketing experience together to enhance in this new digital world.
Sure. So, what kind of services you provide, and who are your what are the kinds of people can approach you uh, for their business solutions?
So I'm doing like a full package of marketing services, from marketing strategy to website to social media.
Okay.
And that's one of the beauties is that everything under one roof. Who I target is, of course, a lot of the healthcare businesses. Reason being, when you are a healthcare business, you very quickly realize that you're not on the same path as everyone else. You
Right.
have much more regulations.
Right.
So if you're talking to a marketing agency who has no clue about it, they're going to struggle. Example, um, Facebook and LinkedIn advertising. You
Yes.
know that if you try to put an ad for a product, you'll very quickly find that it's simply disapproved.
Yes.
And you think like, I've done nothing wrong, I have a certificate for this product. Yes, you do. However, it's against the policies. So somebody who is coming from the healthcare business, I know these things, and
Right.
that's one of the benefits. Now, the other thing is I'm focusing on marketing strategy really. So geographical expansion because of the experience in registration and the multicultural piece. This is something that is really ringing a bell for me. And finally, entrepreneurs. I
Yes.
think that now a lot of the people will find an opportunity in this whole disaster that we faced.
Yes.
And I'm there to help them grow and help them find their way in this new
Outstanding.
market.
Outstanding.
Yeah.
So, in terms of healthcare entrepreneurship in low and middle income countries, what do you see as the trend? Do you see that homegrown entrepreneurship is in the rise or is in the is downhill because of you have big markets, big
Yeah.
companies, big pharma taking over countries, while I would say, start initiating or struggling entrepreneurs trying to grow their own base in their own countries. So you see that. What do you see as the trend, like entrepreneurship versus big pharma?
So it's an interesting one. I mean, firstly, let's begin from the beginning. If we are talking about medical, there is always the regulatory piece, and there is always the ownership piece for the country. So be that taxation, be that importation, be that regulatory, there are a lot of barriers to entry in many markets. So oftentimes the local entrepreneurs, they are very much protected, and they also get benefits from developing their business in these countries. I'm now living in the Gulf countries. Here you see this on the rise. Like, there are companies that are built by local entrepreneurs, and they are well taken care of by the government, which is a good thing because they are also providing jobs to the people, and that's great. Now, on the other side of it, um, it then becomes a conversation between low cost and high cost. So if you are in the low cost business trying to do something cheap, you will never really beat the internationals because they simply have the economies of scale for them, and they are able to invest money into the facilities, which will become a key, while you are not. So if you're an entrepreneur with a new innovative product, you have great chances. If you are just trying to be me too, that becomes much harder now. So to me, it's depending on what kind of business that is. But I do think that for the local entrepreneurs now that are really bringing something innovative to the table, there is opportunity. I'm sure of that.
And with 10x support.
Yeah, of course, sure.
Okay.
But no, I see this. I see it happening. I had one of the customers here which had a really innovative decontamination solution. You know, and they're growing like hell, and they are getting a lot of support because the product is very special. So I think there definitely is room for growth.
Yeah. Thank you for sharing that, Anna, and good luck with the business.
Thank you.
You had mentioned one of your core guiding principles is, or at least core functions, is helping with market strategy. But then you also mentioned, culturalism and multicultural market. There's this saying where they say culture eats strategy for breakfast. So how do you ensure that, as you walk through market strategies, they are applicable for the different contexts and cultures where you work?
And I mean, to me, that's kind of what I breathe, and this is pretty much my whole existence is like that. So I'm very multicultural, and to me, it's natural. I first ask what kind of market are we going to talk to, and to me, understanding that is the key point before you can develop any campaign, really. So it's finding out who really is my customer, and I think that's honestly what I see in the digital world. Is we think we just push a button on Facebook and suddenly all these people come. No, I wish it were that easy. To press a button is very simple. Is it going to give results? No. What will give results is really understanding your customer persona, really. And for medical, that's not an easy one. So once you get to that understanding, then you start to structure around the culture of that country, the culture of this type of group of population, because it may be that we're not only talking about country specific, but also really very targeted niche group. And entrepreneurs now with high performance products, they will first target that. They will first find a specific niche. So you need to know the culture of that niche even, not only just the culture of the people.
And for people to reach out to you, where's the best place they can reach out to contact you?
So definitely LinkedIn or my email. I have my website as well that I guess will be provided at the end. Yeah. And yeah, you're always welcome, even if just for an advice and just to chat about your strategy thinking. I will be definitely up for that.
Gotcha. Wonderful. Any other questions, Maimuna?
No, we just want to thank you for your time and expertise, Anna. We've really enjoyed chatting with you. And like Ashwin said, this is going to be a series of, the private sector's role in helping build health systems. So we look forward to having you again.
I would be really proud to be part of this. And thank you so much for inviting me. It was my pleasure.
Likewise. Thank you so much, Anna. Thank you for your time.
Thank you.